In this video, we are going to show you how to segment the lumbar multifidus muscle. So for this example, we are using a male who has low back pain, and we are looking at the L4, L5 segment on a T2 weighted image. So I have my polygon tool selected, and I'm going to use the red label. And so we can see the multifidus muscle is right around here. Okay, so we're going to use our borders to go through the segmentation. So we want to include this little strip of fat right along the spinous process and lamina. And we are going to come all the way down to the border here, posterior border. And then we're going to use this little white line here. This is actually that line of fat that separates our multifidus muscle from the erector spinae group. It's very clear on the other side all the way down. In this example, we have a little bit at the bottom here and a little bit at the top with a little bit of a discontinuation in the middle, but you can see we're going to follow along that path here and come up to our point. So we're just going to start laying our points down. Again, if you make a mistake and you want to undo the last point, we can click down here. There's lots of time to adjust afterwards. So as we come around, we're going to generally follow that white line, and we want to keep on the inside of that fascial line. And you'll notice that the multifidus muscle tends to have a little dip up here, especially in these lower levels. So we can zoom in, we can move around to see if we hit all those borders. So we're a little bit away from here. So I'm going to take it and just make these little adjustments. Make sure we have a smooth curve through here. And we're coming right up to that border there. So this looks pretty good. If we are happy with this, then we can accept our changes. And we're trying not to go into this part here. This is heading into our fascia and our subcutaneous fat. So once we're done, we can accept. And from here, we can zoom in, we can zoom out, and we can see how it looks. If we were going to segment the other side, we would follow the same process.